This is Shifting Perspectives, Understanding the Treatments, Implications, and Risks of Mood Disorders by Lori Council and Nicole Ryan. Our main goal of this project was to understand the risk factors and patterns of mood disorders, as well as the treatments and outcomes of mood disorders. Mood disorders can have a great economic implication on a community or on a family. People with mood disorders have a higher risk of suicide. And also, a mood disorder is identified or classified as an emotional state of a lot of high highs or low lows, such as depression or bipolar disorder. There are several health disparities of mood disorders, including gender, race and ethnicity, age, socioeconomic status, and also place, meaning urban or rural setting in this case. So let's take gender, for example. Women are more likely to be diagnosed with a mood disorder such as depression because they're more likely to go to therapy. And also, they may get diagnosed after postpartum or during postpartum or during menopause. Race and ethnicity plays a huge role as well. African American and Hispanic populations are less likely to receive adequate care than white populations. Teens and older adults face different issues in their lives, different stressors, and that can play a huge role in the disparities of health. Two more health disparities of mood disorders are socioeconomic status and place, in this case, urban or rural communities. And socioeconomic status plays a huge role because the low socioeconomic status communities or families don't receive as quality or high of quality of care as people with a higher socioeconomic status. And place, in this case, again, rural or urban, people living in urban communities have more access to healthcare, they have more options than someone who lives out in a rural community and even maybe has to drive 45 plus minutes into town just to get that care. The methods that we used to conduct our research were a systematic review of 24 peer reviewed articles, 3 reports, and 3 newspapers, including the Washington Post and the New York Times. We used research from PubMed, JAMA, and Google Scholar, and all of our research was no more than 5 years old, but some of the data collected in that research went back to 2014 because some of the studies took years to conduct. And some of the search terms we used were mood disorders and anxiety. And we also used a snowball method in order to collect similar data as we went along with our research.
Next, we're going to discuss significant findings. 1 in 5 people will have an anxiety disorder during their lifetime. Other findings from our research were that there are increased rates of psychological distress due to a birth cohort of 1990s to millennials having a difference in culture, electronic communication, digital media, and reductions in sleep duration that have a large impact on the population and their mental health. Next, we have 60% of individuals with anxiety also having concurrent symptoms of depression, with comorbidities typically increasing the severity of prognosis, symptoms, and impairment, leading to lower work productivity, greater health service utilization, and increased costs for the individual and economically. Next, it's important to know the signs and when to seek help for conditions before they become chronic. Recognizing symptoms of disorders and receiving earlier treatment are linked to having better outcomes. Having one mental health condition and a comorbidity between mood and anxiety disorders increases the risk of developing another mental disorder found in the research that underlying risk factors are similar for all mood disorders, but no absolute risk was identified. Lastly, we have mental health conditions disproportionately affecting different populations, from teens with social media, populations of young adults, Hispanics, Black persons, essential workers, and unpaid caregivers, and those who receive treatment for pre-existing psychological conditions. Continuing our significant findings, we found that anxiety disorders contribute to about 6.5 trillion or 2.8% of healthcare related expenditures. This graph is from 2020 to show individuals who took a general anxiety disorder screening from January to December of 2020, and it shows that minorities are disproportionately affected by anxiety. Individuals with anxiety may experience lower quality of life, higher direct medical costs, and indirect costs, with individuals having higher readmission rates and gaps in diagnosis, equaling high costs in pharmaceuticals and lack of access to treatment, making anxiety and mood disorders very costly to the individual and economically. We chose to focus on three public health implications. The first being bringing a more holistic approach to healthcare and addressing health inequities in the minority populations and help combat structural and societal barriers that influence the promotion of harmful policies and systems that inhibit minoritized populations from receiving appropriate and quality mental health care. Second being primary intervention and knowing that a child is at risk for developing a mood disorder is as important as knowing that an adult is at risk. Early interventions create better outcomes. And these preventions can be accomplished through social, psychological, and biological interventions. Lastly, we want to talk about healthcare reform. With rising healthcare costs, accessibility and affordability of healthcare is not an option for many groups. We want to create programs that are more cost effective and put them in place for young adults to access. And we want to focus on the continuum of care to encourage the importance of knowing a patient's full health history, social determinants of health, and other factors that could impact the results of the screening tools. Continuing public health implications, we want to focus on healing from the pandemic, with 40% of U.S. adults reporting struggling with mental health or substance abuse in 2020, and 31% of those adults experiencing anxiety and depression. We want to look for better resources and interventions for those who are diagnosed with health conditions during this time and populations that have shown to need greater support, i.e., minorities or at risk populations. Additionally, recognize that people should be given coping strategies and interventions to address COVID related stressors pre and post pandemic. This could be identifying health high risk populations, creating better policies to address health inequity, and improving education about mental health conditions. Next, we will discuss AI tools and applications used to address mood disorders. One study found that machine learning through the electronic health record by using standard clinical data such as arterial pressure, blood pressure, and markers for low socioeconomic status that have been previously associated with depression and anxiety made it easier to identify risk or predict mental health disorders. It can be used instead of patients being treated at the height of a mental disorder to determine if they are at risk of developing anxiety or depression and can help lessen the effects of mood disorders on individuals and families. Continuing our discussion of AI tools and applications, we also found another study that used machine learning and deep learning through the use of the EHR to make it easy to compile information for diagnosis. The indicators that were used gave providers and patients a better understanding of what factors were impacting their mental health, identified unhealthy behaviors, and contributed to knowledge surrounding what biological and environmental factors contribute to the development of mental health disorders. Data given by the patient was used by providers to make them partners in healthcare, and the machines will be able to provide summaries that relate to comorbid conditions and assist in the diagnosis process. To conclude our presentation, we have three recommendations for health educators, public health practitioners, and /or clinicians. We want to make sure we're bridging the mental health care gap by following the framework for the World Health Organization that uses evidence-based technological guidance tools and training packages to improve and expand services in communities that lack resources. This could be for practitioners, individuals in the community, or patients. Next, we want to refine mental health and screening tools. Some of the findings suggest that researchers need to refine the screening tools to make them more effective and to deal with high volumes of patients and stigma and understanding the scope of mental health issues, including comorbidities. Equally, we want to make sure that we follow up and stress the continuum of care and reduce readmission rates. Lastly, we want to speak to breaking the stigma surrounding the individuals with anxiety and depressive disorders. This is not to say that people cannot process emotions, but highlight that disorders are caused by dysregulation that can be remedied with changes in lifestyle, social and emotional support, and pharmaceutical methods.